Hello and welcome to the Andean Medical Mission's series Beyond 2020, the series where we look at how to build eye care services in countries with developing or limited access to ophthalmology. Today we're going to talk about agreements. We're going to talk about making agreements with the town that you're working in, with the patients and the population that you're working for, and also with the team that you're going to bring with you. We're going to talk about what to include in those agreements, why they're useful, and how to implement them. So let's talk about that. The agreements that you're going to have in place, some of them are going to be binding in law, and some of them are going to be binding in honor. It's quite difficult to enforce agreements, for example, where you're asking your team to be kind or to be respectful, because that's a very broad, those words are broad in their definition in law, and they're more about a spirit and attitude. And so a lot of the agreements that we have in place are just literally, yes, they're reviewed by a lawyer, and yes, they are enforceable to a degree, but a lot of it is about spirit, the nature, the reason why you're there, and those are binding in honor. Depending on where you work, if you write an agreement in one country and you exercise that agreement in another, it may be slightly different in terms of how the law would uphold it. But I think if you look at the spirit of what you're trying to do and have agreements that are binding in honor, that are reasonable, that the average ophthalmologist or nurse or optometrist would be happy to comply with, then you're going to be fine. You're going to need to make an agreement with the mayor or with the town officials, and you're going to need to make an agreement with the population at large. And I'll talk about that for a little while. So starting with the government side of things, we, as an organization, the Andean Medical Mission, we always try to get the town as involved as we possibly can. So we go along as the experts who provide the surgery, but we want this to be a joint project with the town as well. We would ask the town to provide us with the accommodation for the team, the food for the team, and some drinks during the day would be nice, and a clinic room for free, and the hospital facilities, so maybe a nurse, definitely the operating theatre. And we would expect that we're not charged for any of those services because they're not that expensive, firstly, and what we're providing is hugely expensive. If we're going, I've got a trip in July, we're going to Magdalena, and we'll be doing probably 50 operations there. Most of it will be cataract. A Bolivian ophthalmologist will charge $1,000 easily for each operation. So we're providing the town with a value of $50,000, and I would expect them to be able to pay for a few £100 for our food and accommodation. We don't have to stay in a hotel. We're quite happy to stay with local people if need be, if it's a small village, but a hotel is nice, and to have the use of the hospital and some staff is incredibly valuable to us. It just allows us to do more surgery if we don't have to pay for those basic costs. And nearly always the town officials will be delighted to host us and to provide what is needed for the team to be able to work well. So get that position out there early, that you're expecting this to be a joint working agreement between the two of you. And then, I mean, in Bolivia we have a whole ton of TV stations and radio stations in the local areas, and get out there and thank the mayor, thank the town, thank the hospital directors for providing those things for free. And what you're doing by presenting the agreement to the town is you're enforcing it in many ways. The second area where you want to have an agreement with the town is around pricing. So we at the Andean Medical Mission, we do everything for free. Maybe glasses we might charge for in the future, but largely all of our surgery is completely free. And you want to get that message out there early, because obviously it's going to bring people to your theatre, to your clinic, because they'll want to take advantage of the cost benefit, but it also stops unscrupulous doctors or town officials from making charges later on. So if you make an agreement with the whole town and you say, we're providing this service, come to us, bring your blind relatives, your mums, your dads, anyone in your family who doesn't see well, bring them to us and we will provide them with free surgery, and there's no cost now and there's no cost in the future. No one will come back and charge you later on. Then that agreement is out there, everybody knows it, and it just stops that unscrupulous person who might want to come back later and say, oh, the first month was free, or the operation was free, but the aftercare it needs to be paid for. It stops that from happening. So agreements with town officials as to what you're actually going to get from them and what you're going to provide to them. Agreements with the population that there is no charge for what you're doing, or if you charge, what that charge is. And finally, you want to agree with your patients that this is a joint effort. We're going to provide good quality surgery. We're going to promise you that our surgeons are qualified, that our theatre equipment is clean, that we know what we're doing, and you need to promise us that you're going to comply with the aftercare that we're going to set for you. And that's really, really important. Otherwise, if somebody doesn't follow, and a lot of people don't, they'll assume that the operation was fine and they'll go to work the next day, and there are limited cases, but they do exist, of patients who've had very poor results because they have not taken the steroids, they've not taken the antibiotics, and they've gone and done heavy lifting and work straight after. So get that agreement in place with your patients that they're going to look after themselves, that they are part of the success of this trip. It's also important to have agreements with the patients and have a consent form signed by them, even if they can't read or write, as long as you have explained carefully how long the operation takes, what is involved, how much pain they will feel, the fact that they have to remain still for up to an hour maybe. Those are really, really important things, and that they need to care for themselves. And then what the risks are, that needs to be explained and be part of the surgical agreement, that they understand that there is a risk of infection, there is a risk of pain following the operation. There could be poor cosmesis if things go disastrously wrong. And your patients need to understand that. You're not trying to frighten them, but you're trying to explain that we will provide good surgery, and we will do the right thing. We'll only operate if we know we can get a good result, we have the experience, everything is clean. There is a responsibility with them as well to make sure that they look after themselves following the operation, or that they don't do things that would be disastrous during surgery, like sit up or want to go home or need to go to the toilet. Those things are really important, that they understand that before they go in to the operating theatre. And ask them, the toilet thing is happens all the time. You say, do you need to go to the loo? And they say no, and then you do the block and you say, you absolutely sure you don't need to go to the loo? And they say, yes, I'm desperate. And that's great. You need to just be clear about what the process is, how long it's going to take, and what could happen afterwards, what's likely to happen, and what we don't want to happen, to make that absolutely clear with your patients. And that needs to be an agreement, and that needs to be signed or marked. We use a thumbprint if they don't know how to read or write, and a witness to confirm that what we spoke about. You also need to have a team agreement, and we have two. We have firstly a surgical protocol, and that is, if you like, a list, or it's a working document actually. It changes over time, but it's a list of all of the best practices, and you ask your surgeons to sign it, that they will follow those best practices. There are differences between the experience of surgeons and the results that surgeons get, and we tend to look at what is different. If you have a surgeon who is getting things right every single time, then what are they doing that creates those brilliant results? And if you have a surgeon who isn't getting those results, then what is the difference? And you'll find steps that are different. And yes, part of it is experience and ability, but a lot of it is just steps that are taken beforehand, and they might be really simple things that make the difference between that patient seeing really well or having average vision or even poor vision following surgery. So have a surgical protocol and get your surgeons to sign it. We have one that you can copy if you want, or borrow, and it goes through all of the steps, largely based around cataract. We have a protocol for pterygium as well, and it just stops people from experimenting. It stops people from using techniques that are not approved or have been audited and don't have the best outcomes, the best results. So it ensures your team are all on the same page. It makes it much easier for your follow-up as well, because you know exactly what the surgeon has done, and you need to have that in an agreement and signed by your surgeon. So it's really important, and as I said, I'll link a copy below. You also want to have a working agreement with your team, and this is also a document that I get people to sign. Probably a lawyer could break this because the agreement is very much around attitudes, but it's important that everybody is there to help, that people go with the same work ethic, so you don't have one person in the team who's working really hard and then someone else in the team who's kind of having a holiday. You want that balance with everybody working well, everybody working efficiently and hard, so that the team doesn't break up, it doesn't begin to fracture. And getting people to commit to that right at the beginning helps a lot. And if somebody doesn't want to work hard and doesn't want to sign the agreement, then great, don't take them. They're not the right person for you. You also need to have elements in there of respect, you know, working with each other, respect for the patient, doing the right thing, being kind. They're all elements around attitudes that people can choose to have or choose not to have. And for your mission to be a success, you want people with good attitudes, doing the right thing, working hard and supporting each other, because this can be hard. You have uncomfortable temperatures, you have hotels or places where you're staying that are often very uncomfortable. You're working very long hours, you may have food that is giving you difficulties, and the last thing you want is to have a team that is fractured and not working together and not enjoying what they're doing, and ultimately that impacts on the patients and the outcomes that they get. So have a team agreement, make sure everybody is on the same page, make sure everybody is there working at the same pace with the same standards of care. And most people do. This is almost just solidifying what everybody already knows, but it's worth having, and it stops that one occasion which could potentially ruin a trip or impact on one or two patients' vision. So have that in place as well. Just a written document is fine, and then get everybody to sign it before they buy their tickets, before they purchase their flights, unless you're providing flights for them. And then on the first night of everybody arriving in the village or the town that you're going to work, it's worth going through the surgical protocol again and just reinforcing it and making sure that everybody agrees, and going through the team agreement as well and just reinforcing it and getting any worries or concerns out of the way. And then, you know, you're into the surgery and working hard, and everybody's on the same page. So I hope that's useful. There are things we've learned over the time. Just to summarize, it's getting an agreement with the town, making an agreement with the population, understanding your patient's concerns and having an agreement with them, and having an agreement with your team. And if you put all of that into place, then your trips are going to be an awful lot easier, they're going to be a lot smoother, they're going to be a lot more enjoyable, and ultimately your patients are going to benefit. If you've enjoyed today's chat, then please feel free to drop a comment, and any suggestions, any improvements to the protocols that are attached will be welcome. And yeah, feel free to like and subscribe to the series. There's a lot of experiences that I'm hoping to share on Beyond 2020 that will be very useful for people doing similar work. It'd be great to connect with you and to hear what you're doing. So yeah, let's stay in touch and see you on the next one. Thank you.